All right, part 2 on the urine analysis, we're going to go over the chemical examination. Now, the chemical examination of a basic urine analysis is a lot more extended than the physical exam and the microscopic exam, so I might make this into 2 videos depending on how far we can get on each of these markers and how much I want to ramble about them. But typically, the chemical analysis portion includes protein, glucose, ketones, blood, leukocyte esterase, nitrites, bilirubin, and bilinogen in the analysis. And all of these mean sort of separate things. So the first thing is the protein. Earlier in the physical examination, I mentioned that if there is frothy urine, that is typically indicative of protein in the urine. And generally, if you look at the dipstick analysis, it will be sort of a color on the block that you match with the canister, and then you can kind of see if it's normal, trace, or like more than that. And normal protein in urine is usually negative to trace, which corresponds to less than 150 milligrams that is coming out of your urine. If it is 1+ or more on the dipstick, that usually corresponds to 300 milligrams per liter or more of urine protein that you're losing to your urine. And that's typically a case where we want to further evaluate why are your kidneys leaking this much protein? Because that's not supposed to be normal. And again, usually when you're leaking protein into urine, this usually means there's some sort of micro damage in your kidneys, some damage to those glomeruli that are filtering and that are actively filtering your blood through your kidneys. If there's protein leaking through there, that means there's some damage going on, and we want to figure out what it is. The next one is glucose. Normally, in urine glucose, it should be negative. This should be stuff that your body wants to keep and that you are actively reabsorbing through the process of filtration in your kidneys. And typically, when glucose starts showing up in the urine, when the dipstick starts becoming more positive, this typically already means that your blood glucose is more than 180 milligrams per deciliter. For that to be able to show up in your urine. So this is already when your blood sugar is really, really high. This is something that should definitely be checked against your blood glucose, though, because there is the possibility for the urine glucose to be high and the blood glucose to be normal. And this suggests a whole nother condition called renal glucosuria, which needs to also be worked up because, again, this is another kidney issue in which the kidney isn't properly reabsorbing and filtering properly, which is leaking glucose into your urine. I think the last one that I'm going to talk about here is going to be the ketones, because this kind of neatly divides the chemistry into sort of the metabolic portion and more of the infectious portion here. So with ketones, general, normal, if you have a normal diet and you're eating carbs, this should be negative. If you are on a ketogenic diet, this could be traced too small with normal glucose and without acidosis, which means the pH is normal in the normal range. If the ketones are moderate and there's also normal to low glucose and no significant acidosis, again, the pH is in normal range, then sometimes this can mean that this person is under the effects of starvation. Now, on the extreme side, if the ketones are really high, very often this corresponds to over 250 milligrams per deciliter of ketones. And if the pH is over 7.3, this is diabetic ketoacidosis. So this is kind of an emergency. Another interesting tidbit here is that in up to 30% of pregnant women, there could actually be positive morning ketones without any sort of pathology or without any adjustment of the diet. So that's kind of interesting as well. Okay, and I'll talk about the rest of the chemistry portion of the urinalysis in the next video here. So if you have any questions about what I talked about here, go ahead and drop it in the comments, and I'll see you in the next one. Goodness. Thanks.